Determining your fingerprint patterns. Most of us know that fingerprint patterns are unique to each individual, a fact that has made fingerprinting of supreme interest to law enforcement. However, scientific fingerprint analysis, called dermatoglyphics, can tell doctors about your risk for certain diseases. Here's how to do it. If you are taking your fingerprints at home, let's review how you can get the best results. You'll need an ink pad and bright white paper with a smooth finish, or you can use the materials included in your biometric test kit. Wash and dry your hands thoroughly. Bring the ink pad to the edge of the table. Hold the ink pad steady with the hand you will not be fingerprinting. Roll your finger lightly in the ink from the inside, the side closest to your body, to the outside. Press lightly and make sure that you get ink on the finger pad all the way down to the first crease. You are not interested in the fingertip, rather the finger pad. Now, bring the white paper to the edge of the table. Press your inky finger lightly onto the paper. Roll it lightly from the inside to the outside. Don't press too hard. Once you've done all 4 fingers, prepare your thumb for inking. It is important to roll the thumb from the outside to the inside, which is different from the fingers. Label your fingerprints for left hand and right hand, as well as each finger. Once you've completed your fingerprints, it is important to know how to read them. Reading fingerprints may seem complex, but once you get the hang of it, it's actually quite simple. In order to interpret your results, it is important to look for what's known as a pattern area, the area within which you can actually see the fingerprint pattern. Pattern areas are surrounded by type lines, ridges that basically outline the pattern. A landmark that can help you to more easily locate patterns is called the delta, and it is a little triangle in the midst of 2 ridge lines. Once you've identified the pattern area, you'll be looking for 3 basic patterns: arches, loops, and whorls. Arches are the simplest pattern, a succession of parallel ridges that look like a little hill. Loops are the most common pattern. They look like tiny lassos. The most frequently seen type of loop opens towards your pinky finger and is called an ulnar loop. Less common is the radial loop, which opens towards the thumb. Whorls are a series of concentric rings. They might be spiral, oval, circular, or anything else that looks round. One delta, and you can call it a loop. 2 deltas, and you can call it a whorl. No deltas, and you can call it an arch. Record your results on Section 1 of the Fingerprint Analysis Worksheet. Fingerprints can even disclose just how much stress you may have experienced due to an unstable fetal environment. We can determine this by comparing the patterns of the fingers on one hand to the patterns of the fingers on the other. This is called a check for symmetry. The more fingerprints that match from hand to hand, in other words, the more symmetrical you are, the more stable your prenatal time in the womb. Less matching, or the more asymmetrical you are, the more likely that your early days were unstable or stressful. Now record your fingerprint symmetry results on Section 2 of the Fingerprint Analysis Worksheet. Finally, let's take a minute and talk about fingerprint white lines. Although your fingerprint pattern does not change throughout your life, the height of your fingerprint ridges often goes up or down depending on the health of your digestive tract. White lines appear on fingerprints when the fingerprint ridge height is so low that the underlying skin creases are seen. This indicates an intolerance to gluten and lectins, often seen in people with celiac disease. If you've noticed lots of white lines in your fingerprints, record your results on Section 3 of the Fingerprint Analysis Worksheet. For more information on fingerprints and their relation to health, refer to pages 69 through 74 in the Genotype Diet book.